Well, a lot of your work is about excitotoxins, and so why don't you explain first what that is, so some people listening might not know what that is, and then two, how you got into that study.
Well, it was really quite by accident. I really had not intended to do it and didn't really know anything about excitotoxicity. Like most people, I'd heard of the MSG-type syndrome with the headache and the flushing, and I didn't know a lot about it, but I stumbled across an article when I was doing some studies on behavior and nutrition, because I was interested in how nutrition affects behavior, the higher functions of the brain. And I came across an article that was written on neuroendocrinology and MSG, and the effect of MSG on these brain centers was the things that they knew about it at the time, which was really in the very beginning. But I found it intriguing, and then I found connections to some very bad diseases like Alzheimer's and ALS and Huntington's disease, and that it appeared that these excitatory substances were playing a major role. Well, at the time, they didn't even recognize that glutamate was a neurotransmitter. They weren't sure what it did in the brain. But since that time, we've just learned an enormous amount about it. Since I've written the book, Excitotoxins, which was in 1994 or 5, the amount that we've learned about these substances is just incredible. And it's now considered to be one of the major mechanisms of virtually every neurological disease. You can't pick up a neuroscience journal or a neurology journal if they're not talking about excitotoxicity. It's a very big field and a major field in the area of why things happen to the brain. Particularly now, the interest is in things like depression, addiction, the higher order brain functions. And we've learned that the glutamate actually is the number one neurotransmitter in the brain. In the cortex, it makes up 90% of all neurotransmission. So it far exceeds all the other transmitters, and it actually plays a role in controlling their functions, like serotonin, dopamine, norepinephrine. They're regulated by the glutamate receptors. And the glutamate receptor system is just now enormously complex. It's just very, very complex. It explains the complexity of the brain because of the complexity of this particular type of receptor. Well, you know, the thing that concerned me was that all processed food contains variable amounts of glutamate additive. Some foods, quite a few of them, have just enormous levels. And they have an impact on disease states like Alzheimer's, dementia, ALS, minimal cognitive impairment, brain trauma, strokes. All of these things, they're playing a major role. So people eating foods that contains enormous amounts of these things, it's putting them at extremely high risk. So that was a big concern. But now we're finding out that it's also playing a major role in human behavior. As I said, it seems to be the main neurotransmitter involved in depression. We used to think depression was serotonin, dopamine, and they play a role, but it appears that the major role is by glutamate type receptors in neurons. And even addiction, people that become highly addicted have very high levels of glutamate transmission in particular parts of their brain. Schizophrenia now is considered a glutamate disorder. We're beginning to find that just virtually everything you can name neurologically in some way is connected to this excitotoxic process. Well, the problem is that the neurologist, the practicing physician, has no concept of any of this. It's way over their head. Most of them have never even heard of it. And they certainly have no understanding of the dangers of this enormous amount of excitotoxic additives to our food. For instance, some potato chips have 3 or 4 different forms of this glutamate additive. and they have liquid forms. They put it in gravies, and the government allows them to put enormous amounts in foods. And they can even disguise it. Since I came out with the book and have done a lot of interviews, the food industry recognized that a lot of people were refusing to eat these foods, and so they started using disguised names. And they even put on the label, contains no MSG. And then you look at the label, it has about 3 or 4 different forms of disguised MSG or glutamate. So there's a lot of chicanery in the food manufacturing. One of the really big things that concerned me was the children. Children were eating a lot of these snack foods that are enormously high in excitotoxins, and it has effects on their behavior. Things like disruptive behavior, anxiety, panic attacks, depression, anger, violence, being unable to concentrate in school, paying attention, being disruptive in the classroom. All of these things are related to that, and it's in the neuroscience literature, and we know it now and how it works and why it does that. Well, glutamate is the main excitatory transmitter in the brain. That's its function. But it's also one of the most toxic neurotransmitters in the brain. It has to be very carefully regulated by the brain. We were not meant to eat foods that contain enormous amounts of glutamate. Well, humans are about 5 times more sensitive to the toxicity of glutamate than any known animal. Young humans are about 4 times more sensitive than a full-grown adult. So they're at the highest risk of having severe problems. So despite the fact we know all of these things, most of the public is completely unaware of it. Vast majority of physicians have never heard of it. Even neurosurgeons, neurologists that I've talked with over the years, they never heard of it. And yet you can pick up any neuroscience journal, and it's one of the main topics they're talking about. It's considered to be the central mechanism in a great number of neurological disorders. And most of the pharmaceutical drugs are now being designed to produce protection against excitotoxicity in the brain. Now, when a person, and they've measured this in several different studies, a person eats glutamate in the food, their blood level goes up about 20 to 50-fold. So it's a tremendous elevation in their blood level. And that seeps slowly into the brain and increases this excitotoxic damage. As you get older, your blood-brain barrier is not as effective. And so the older people start getting a lot of complications from it. Well, people eat these things and they don't recognize the symptoms. Since it's an excitatory neurotransmitter, one of the common symptoms is insomnia. Well, most physicians know that's one of their biggest problems they see is people with insomnia, a lot of young people having trouble sleeping. Well, if they eat a late supper that's high in glutamate, the brains are going to be so aggravated in this excitotoxic state that you're not going to be able to sleep. I spent a lot of time studying the brain, but then I discovered that this is a really unusual receptor. It is found through everything that's alive. It's a transmitter and a receptor that's used in plants, in bacteria, various microorganisms. It's everywhere. Every animal has glutamate receptors. It is the major transmitter in the entire body. They've now discovered that there's glutamate transmitter receptors in the bones and the muscles, through the entire GI tract, the lungs, the pancreas, the reproductive organs. Every tissue in the body has glutamate receptors, just like the brain. So when you're eating this food that's very high in these excitotoxins, you're overstimulating these receptors in all of these organs. Well, we know when you overstimulate those receptors, it makes the body produce enormous numbers of free radicals. And so that increases your risk of a great number of diseases, including heart attacks and strokes. A recent study found that all the lining of their arteries has glutamate receptors. And they found if you take animals and you feed them MSG in about 3 or 4 doses when they're young and then stop feeding them the MSG, they have high levels of free radicals produced in their blood vessels for the rest of their life. So with humans consuming such massive amounts of this stuff when they're young, it means their blood vessels are producing a lot of free radicals, and it explains why now we're seeing a tremendous increase in strokes in young people, something we used to rarely see. But it's increasing tremendously, and it's because they're just consuming massive amounts of this MSG-containing food. So all of your organs contain these glutamate receptors, and it's playing a big role in a number of diseases. Now, one of the diseases that really concerned me is that they discovered first in the brain that brain tumors grew infinitely faster, about 6 times faster in the presence of glutamate. And the brain tumor became significantly more invasive, so it became incurable. When they started looking at other cancers, to their surprise, they found virtually all cancers grow infinitely faster in the presence of glutamate and invade other tissues and metastasize throughout the body much faster in the presence of glutamate. And they found, in fact, if you looked at certain cancers, the one that secreted the most glutamate grew the fastest and were the most incurable. The ones that had the lowest amount of glutamate were much easier to cure. Well, when they started looking at this, they found out if you expose these tumors to glutamate, they grew real fast, but if you block the glutamate receptors, the cancer began to slow down its growth tremendously. And that if you added glutamate blocking drugs to the regular chemotherapy drugs, they started working a lot better. And the effect was the fact that you're preventing that glutamate stimulation of the cancer growth and invasion. Well, much to my joy was the fact we discovered that there's a great number of natural appearing substances that significantly reduce glutamate excitotoxicity. For instance, things like green tea, resveratrol, curcumin and quercetin, apigenin and luteolin. They're all very powerful inhibitors of this glutamate growth process, particularly for cancers. And it may explain why a number of these natural found substances are enormously powerful at inhibiting cancer. And in fact, when you look at people who survive what would be considered incurable cancers, most of them are consuming very high concentrations of these substances. And we've seen some pretty remarkable cures in some people that, like I say, normally would be classified as incurable by traditional medicine. When you combine these flavonoid substances from plants and fruits and teas with conventional chemotherapy, we find the chemotherapy works infinitely better, and you have far fewer side effects. So even if you decide you want to follow the traditional treatment of cancer, you're going to do a lot better with a specifically designed combination. I know a number of people who have widely metastatic cancers whose survival rate would be less than 10% for 5 years, who have gone 10, 15 years doing very well as long as they stay on this diet and continue to consume these powerful anti-cancer flavonoids. Well, when we look at the brain, and one of my interests is in neurodegenerative diseases like Parkinson's and Alzheimer's and ALS. These same flavonoids from plants are very, very protective of the brain. We know that, for instance, the epigallocatechin gallate from green tea powerfully inhibits what we call immunoexcitotoxicity, which is an inflammation of the brain that's combined with the excitotoxicity. It has a very potent effect in calming that down. We know that resveratrol does, and that curcumin is enormously powerful at protecting the brain against this immunoexcitotoxic process. We know that ellagic acid, quercetin, we know that the DHA from fish oil, magnesium, all of these things, what they do in the brain is they calm down immunoexcitotoxicity. I'm going to revise the old excitotoxin book and bring it up to date and put a new title, immunoexcitotoxicity, because now we know that overactivation of the immune system, this inflammatory chronic process, causes excitotoxicity to be magnified enormously. And this seems to be the cause of most of our degenerative brain disorders like Parkinson's and Alzheimer's. For instance, if you look at Parkinson's, number one cause is exposure to pesticides, even in extremely low concentrations. It activates the brain's immune system, the microglia, and produces this chronic state of inflammation. And that triggers excitotoxicity in the same area and destroys the cells and the connections. Well, these flavonoids and these different nutritional substances like vitamin E and C and your traditional vitamins, your riboflavin, thiamine, they all protect against this excitotoxicity and calm down that immune overactivity. And it's going to make a big difference. We're already seeing in some of the early studies a dramatic slowing down of the progression of things like Alzheimer's disease. In some cases, it's reversed. There was a letter to the editor of Science magazine. A physician was writing in talking about his mother, said she stayed on these supplements that were anti-inflammatory, and she did fine, and her doctor took her off of them for some reason, and she became demented. And he remembered that, so he put her back on them, and her dementia went away, and she was fine. So if you catch it early, you can certainly slow it down or possibly reverse it. And when we look at what we know about the pathophysiology of Alzheimer's disease and other dementing diseases, it makes sense.
And so aspartame is grouped into the excitotoxin category. Can you explain a little bit about that?
Aspartame?
Yes.
Well, it contains an excitotoxin, aspartic acid. That's part of the molecule. Its main problem is its breakdown products. As it slowly breaks down, it turns into a potent carcinogen. It turns into a DNA toxin. It breaks down into part of its molecule is formaldehyde, which is associated with a high incidence of brain cancer. That's one of the things we see with people who consume a lot of aspartame is they have a high incidence of brain cancer. That's what they found when they first studied aspartame, is a 47-fold increase in brain cancer in animals that were given the aspartame. And it was dose-related. The more they consumed, the more brain tumors they developed. Well, we're seeing just an enormous number of brain tumors in young people in this country. And the neuropathologists haven't a clue as to why. They can't find anything other than the massive consumption of aspartame. Formaldehyde has always been known as a major inducer of brain cancers, brain tumors. And you consume a lot of aspartame, you're consuming a significant concentration in relative terms of formaldehyde, which very tightly binds to the DNA. It's almost impossible to remove, and once it binds to the DNA, it breaks it, and that's what leads to the cancer. They knew this from the early studies before it was ever approved. In fact, that's why it was not approved to begin with, is because it produced so many brain tumors in the experimental animal. But they just waved it aside and approved it anyway for monetary reasons and payoff of people who had the power to override these decisions of the scientists. And so now everybody's getting poisoned with aspartame. But I would warn people to avoid it. Particularly don't let children drink it, because that means they'll have a lifetime exposure. Puts them at a high risk of things like leukemia. There's a new study out that one of the largest ever done. It's a lifetime rat study done by a very prestigious group, and they found a significant increase in leukemias and lymphomas. Well, that's the fastest growing malignancy in people aged 30 and below. And, of course, those are the people consuming the most diet drinks and diet aspartame sweetened foods. They also found an increase in breast cancer and brain cancer. So, these things are, again, confirming the earlier reports, the earlier studies, that this is a substance associated with significant increase in some very deadly cancers. And I don't think I would risk the idea of losing weight and exchange it for a leukemia, lymphoma, or a brain tumor, or breast cancer. And, of course, the interesting thing was there's several new studies that's come out show that aspartame and a significant number of people actually causes weight gain rather than weight loss. And, in the book, I wrote about obesity and MSG. And since that time, there's been a lot of studies in laboratories all over the world showing that early exposure to MSG as a child or a small baby programs that child for a lifetime of gross obesity. They also have a very high incidence of metabolic syndrome, where they have diabetes, hypertension, abnormal blood lipids. And there's Americans, have about 45 million Americans are suffering from metabolic syndrome, and it's gone up to almost 70 million. Mainly, it's hitting young people, the very people whose parents were taking high intakes of MSG. They took it when they were pregnant, and now they've given it to the children. And then we're seeing this epidemic of obesity. Well, if you look at the studies, and every animal species known, if you feed them MSG early in life, they become grossly obese, and they develop type 2 diabetes and metabolic syndrome. So we're paying a huge price for people not being told this. And the people that are told, when they ignore it, they're running a risk of ruining their children's lives because the science is there, proving that this is a major risk factor for gross obesity. And the characteristic of the obesity is very difficult to exercise off. It's very difficult to diet off. It's a very tenacious obesity.
And didn't they recently just change the name of aspartame products?
Well, they're always changing the name of these products. It's hard to keep up with them. And they do that because they know there's a lot of bad publicity and people are starting to hear things, so they'll just change the name of the product. I mean, they do that with MSG. They're just constantly changing names. I spoke at a conference in Chicago, and one of the manufacturers of food additives was at the conference. And after I spoke, he came up to me and asked me, he said, what's your objection to MSG? And I said, well, you heard my talk. You know what it is. And he said, well, I just want to let you know, he said, as a manufacturer of this, we're going to put it in the food no matter what we have to do. He said, we're going to keep it in the food. And I said, well, that's fine, but I'm going to tell everybody I can what you said. So now your audience has heard straight from the mouth of the person who told me that they were going to do whatever they had to do to make sure these dangerous additives remained in the food. They didn't care what the science showed.
And so they're leaving it in because it tastes better, right?
It's a taste enhancer.
Okay.
And you see, early on they had a lot of problem with canned foods because it had this tin-like taste, this tinny taste, and so people didn't like canned foods, and so they started putting MSG in it, and you couldn't taste it. MSG makes everything taste delicious. You put MSG in a soup, nobody can compete with it. You can use rotten vegetables and rotten meat and put MSG in it, and it tastes delicious. So they caught on very quickly back in 1948, and so all the manufacturers use it. Well, one's not going to quit using it and let the others use it because the ones that are still using food's going to taste a lot better. But what they need to do is learn the old way, and that is use spices and herbs and things in the food, and it tastes delicious. You don't have to add dangerous MSG chemicals to it or glutamate chemicals to it.
You mentioned MSG syndrome. How does someone know they're experiencing it?
Well, if you have MSG syndrome, you're really a lucky person because you'll avoid it. For instance, if you go out and eat and it has soup that has a lot of glutamate in it, you may have a tremendous pounding headache. You start flushing in the face. Some people flush in the chest and the arms. The heart starts beating real fast. You feel these palpitations, shortness of breath. Some people develop diarrhea after eating because of the glutamate receptors in the GI tract. Those are the common symptoms of the MSG-type syndrome. But the problem is that people who don't experience that are at the biggest danger because all this subtle damage is going on in their brain and they don't really feel anything that untoward going on.